Good morning, everyone. Welcome to our Monday morning briefing for COVID-19. I'm Carrie Schutte. I'm a spokesperson for the Unified Command here. I'm working on the COVID response. I'll start with our numbers and then we'll introduce everyone who's here with us today. As of today, we have 26 confirmed cases, including 0 new cases over the weekend, so that was great news. We've got 963 negative tests, including 10 from yesterday. Our total tests to date are 989. We have 3 people in isolation, 13 on quarantine, 19 recovered, and 3 deaths. We have 1 person hospitalized right now, and during this incident, we have had 7 people in total hospitalized. I wanted to remind everyone that while testing was very limited early in the response, I'm sure you all remember, more testing is now available, and people who are experiencing symptoms of COVID-19, which are fever, cough, and shortness of breath, they should contact their healthcare provider to be tested. If you do not have a healthcare provider, or if you're having trouble getting a test for another reason, but you do have symptoms, the symptoms mentioned above, please call Shasta County Public Health at 530-225-5591 so they can screen you over the phone and schedule you for a test if necessary. Okay, so I would love to introduce all our folks that we have with us today. We'll start as usual with our administration side. We've got Sheriff Eric Magrini. We've got Chief Brett Gouveia from CAL FIRE and the Shasta County Fire Department. We have Matt Pontus, the CEO of Shasta County. And then we have Dr. Karen Ramstrom. She's our Shasta County Health Officer. And Dr. Michael Vivakis is our Deputy Health Officer. Do any of you have anything new to share with us this morning?
I do not, thank you.
Okay.
Nothing to report for me.
To start? Okay. All right, then we'll introduce our hospital representatives, our healthcare representatives. We've got Mark Mitchelson from Shasta Regional Medical Center, Robert Folden from Mercy Medical Center, Valerie Lakey from Mayor's Memorial Hospital District, and Dean Germano from the Shasta Community Health Center. Good morning and welcome. Thank you for being here with us again. Do any of you have anything new to share with us today?
Yeah, hi guys, it's Mark Mitchelson from Shasta Regional. Only thing that we wanted to share is we're really excited. We were able to receive a rapid test machine last week. So being able to provide that service to the community, and you know, we're still following CDC guidelines on we only test people that meet the criteria for testing of COVID, but at least it gives us another avenue to support our hospital and community. So just wanted to share that and how excited we are for that.
Awesome, thank you, Mark. Any of our other hospital folks have anything, or healthcare folks have anything to share today?
This is Dean Germano at Shasta Community. I would just say we have taken into account the new CDC guidelines, and we're requiring all staff at the health center to mask, and all patients coming in not only will be screened, but they'll be required to mask coming in our facilities.
Okay, thank you. Anyone else from our hospitals? Okay, then we are ready to take questions from the media.
Yeah, is there any word on expansion of testing capability for the general non-symptomatic population?
So to test people who don't have symptoms involves a different kind of test than what we've primarily been talking about, the tests that we have at Public Health and that the hospitals are using, and the commercial testing widely available right now. That kind of test actually tests for nucleic acid from the virus that's actually reproducing in a person's nasopharyngeal tract. To test somebody who doesn't have symptoms would involve a test that looks for example, an antibody response, and that technology is available, but is still undergoing research to figure out how it can be applied and best used. And so that's kind of ongoing. Right now, the test that we're using is not approved for use in people who don't have symptoms. There has some testing use of our current test in that setting, again, under kind of more research or surveillance reasons, but not for patients.
Well, right off the top, Carrie said that more testing seems to be available. How much more? How much easier is it now for someone to get a test?
So as we've said all along, testing for COVID-19 is a challenging process. And the challenge starts with the way the specimen is collected. So it involves actually somebody who's a healthcare provider collecting a specimen from the back of one's nose, ideally. And so that can't be done at a commercial lab. And so that's kind of one of the main challenges with this test is you actually have to go to the doctor or one of these mobile drive-up options to get a specimen collected. Beyond that, though, we also have had challenges with the supplies, and that seems to be waxing and waning. We have been on that. We have staff dedicated to try and get supplies, looking at a variety of vendors, whether it's the transport media or the swabs. But the test turnaround with the commercial lab testing, I heard end of last week from a couple of people that they had less than 2-day turnaround. So that piece is good. There's more, I think, capacity at the commercial labs to run the tests more quickly once they receive the specimens. And there are some other things coming along that I understand are going to be available that the state health department's planning a call with us hopefully later today. So we'll keep you posted on that.
Is testing, though, more available now? Like it seemed like before it was only if you really needed a test would you get one. And now I'm just going off what Carrie said at the beginning, that it sounded like more like if you think you need a test, maybe you can get one now.
So yeah, so it is more available for all those pieces I just described. Because just addressing those barriers have made it more available. In addition, we have options for people who don't have a doctor to go to get that specimen collected, and that's what Carrie was referring to. And so for people who don't have a provider, they can call and we can help facilitate that specimen collection by calling the numbers that Carrie provided.
Thanks. As long as I've got you here, Doctor. I asked about this last Friday, and then we did a little more research. There's this study from Johns Hopkins that was disseminated by the state that says that on June 1st, Shasta County would have 57 deaths. Does that seem realistic, reasonable?
So I think, so I've seen that study, but again, as I mentioned the other day, I've seen it for ICUs and hospitalizations, and that data is presented in a wide range. So for example, from 70 to over, several hundred people. So those again are, as we've discussed, that's modeling to use for planning purposes. And that range actually is in response to what we're doing in terms of social distancing measures. So the more social distancing measures you do, then the closer it's to the median or the lower range that you get. And so as I mentioned, I haven't seen the chart for the deaths, but I think it's a similar concept as the hospitalization or ICU admissions, and that the more social distancing measures are in place, then you're going to be at the lower end of that range. And so what we've seen so far for the state of California and for Shasta County is that we're doing really, we've seen an impact of our social distancing. Our numbers have gone down.
And that's been great. As long as I have you, one more question and then I'll be quiet. Unrelated to that, I ran into somebody at the ATM yesterday who was in the medical field who said the federal medical stations are only cots and blankets. There's no medical equipment. Is that true? And if so, if there is a sudden surge, do we have the equipment necessary to put into the FMS?
So there's more supplies than you mentioned, but it's not an exhaustive list. But it's the basic things to get started, and the idea would be that the people that would be cared for there wouldn't have extensive medical needs requiring any type of more advanced types of machines or technology or equipment. And so, but we, would have to reorder supplies, but there's other things in there that you need just in terms of like bedding and those kinds of things, the beds as well. But more than what you just listed.
Okay, but it sounds like the FMS is pretty basic.
Pretty basic, yep.
Thank you, Doctor.
Hi, this is David Benda with Record Searchlight. Following up on the FMS, we're a few weeks along since it was set up. Can you be any more definitive of how long that's going to be in place at this point?
So we were just discussing this morning, and all of us are aware that this is an evolving situation. So we're in this lull right now. We don't really know what's going to happen when the governor modifies the stay-at-home order. Certainly, any loosening will put us, our county, at risk of having exposure in more cases. And so we don't know where we'll go from here. We're hoping to maintain some amount of those prevention measures while we sort of gradually, hopefully, loosen things up over time. But even as we do so, the idea is to have that backup capacity. Whether we're going to use it or need to use it or not is yet to be determined. Our hospitals have been amazing partners and have done a lot of work to make sure that they have really good surge capacity. And so that may be sufficient. But we have the FMS available should we need it. We're currently having conversations about, well, it looks like right now we're not going to need it not in the near future. And so what do we do with that? And so some of those planning conversations are happening now. And you can imagine it's a daily conversation about how are we looking and where should we go from here in order to make sure we're ready, but also have plans in place. So if we needed a surge, we'd have staffing and all of that, but at the same time, not, outlying resources that are not needed at the time. And so those conversations are ongoing.
And then I had another question. We've been getting emails from readers from time to time expressing concerns about, they go to a grocery store and they think it's irresponsible because some of the employees aren't wearing masks. Could you lay out what are the rules at this point in terms of that?
Well, right now, in terms of those essential businesses, it really is up to that employer to make sure that they're integrating those social distancing best practices. Some are doing that more extensively than others. And as consumers, I think it's all up to us as well to just let businesses know when we're not comfortable with their practices. We're doing our best to try and respond to those kinds of concerns and educate and help support those businesses to implement those practices. At the same time, we don't have great science. We're trying to do the best that we can and implement anything that we can think of that might decrease exposure in those kinds of settings where we need to go and get, goods to live our daily lives. And so, I think slowly I'm seeing more and more businesses having their employees mask, and the public as well. And so as we start to move towards loosening of some of these measures, you're absolutely right. We're going to have to be more thoughtful about making sure that those best practices are in place in the businesses that we frequent.
Thank you.
Any other questions this morning?
Hi there. Good morning. This is
hi.
Donnie Chamberlain from a news cafe, and I have a question I have a question regarding some of the protests that are happening in 7 states, including California. And this question is for Sheriff Magrini. Do you have a plan in place in the event that those kinds of protests?
Thanks, Donnie. have regular meetings with our two chiefs here in Shasta County. However, for the sheriff's office specifically, I would assume that any of those protests would take place within the cities and would primarily fall on the responsibility of those chiefs. We have had some discussions dealing with different public concerns. We have not, however, specifically spoke, at least in our group, on any demonstrations related to COVID.
Police department, if it happens in Shasta Lake City, then that's a county issue. Anderson is its own jurisdiction, so it's city by city within the county.
Correct.
Any other questions this morning? Okay, well, in that event,
I do have one more quick.
Sorry, go ahead.
Carrie. Sorry.
No, go right ahead.
I do have one quick question. I have one quick question about the homeless population, and there's some talk on a state level about Motel 6s being the places where the homeless can be housed. Do you know if that's happening here in Shasta County, and just what the process is as far as the homeless being?
So that is, that's being handled right now by Christy Coleman, our director of Shasta County Housing. She was on with us on Friday. I want to say Friday. Yes, she was here on Friday, and she spoke to that a little bit. We do have some people who are being housed in that way right now. It's for people who are either on isolation or quarantine, or people who are at very high risk and are unsheltered. I don't know if maybe, Dean, do you have anything you wanted to add to that? I know you've been a great partner with that.
It's exactly right. We've appreciated the help. Our HOPE team and outreach have helped to identify some of these folks, and we're doing some screening down at the mission as well each day, weekday. So it's been nice to be able to move these people into more stable housing, and all three of those categories are in play. So for now, we have some capacity, which is nice as this thing rolls on.
Any other questions this morning? Steve?
Yes. It's similar to the same thing I keep harping on each one of these briefings. I've heard a lot of experts, Dr. Fauci and a lot of the other experts, saying that the key to returning to life as we used to know it would be widespread testing, the rapid testing of the asymptomatic population, so that any outbreak could be caught and contained right away. So in light of that, is there a plan for widespread testing of the asymptomatic population? I know, Dr. Ramstrom, you did answer that, Dr. Ramstrom, with that it's a different sort of testing, but is there a plan for that?
So, Steve, it's a great question, and there are questions that are happening on the national stage. You know, I know that there's various academic institutions that are trying to develop tests, and we don't have those readily available here. And some of those academic institutions are making them available potentially, in their local community while they're doing figuring out how to apply those tests. There's a lot of work in developing testing for COVID-19. We are fortunate that the state has a task force dedicated to that work right now. Right now, the focus has really been on increasing capacity of people who are sick. We need to take care of people who are sick and be able to rapidly test them and isolate them and get them care should they actually test positive for COVID-19. That's the focus right now. And so that task force has been working on getting designated areas throughout the state that have high throughput that can actually really increase the turnaround, decrease the turnaround time for commercial testing. So that's been the focus. Where the technology goes from here for asymptomatic testing, I don't know. It's ideal the way the current test performs. As I said, it's indicated for people who actually have symptoms, and that's where it's been validated. Whether there are ongoing studies of how it performs in people who don't have symptoms, depending on, that's going to depend on a lot of variables, like how much transmission do you have in the community, to determine how valid that test would be. And so I think all of that is in development right now. I think I would like us to see we're being a place where we can actually rapidly diagnose somebody who has symptoms so that we can actually isolate and quarantine those people and get them care. And so, quarantine their contacts. So that's kind of the focus right now. And I think the state task force is making good progress. But at the same time, we're trying to address all of these other barriers to make sure that they're not impeding our providers to be able to take care of patients. And that includes making sure that we have supplies available, that they have PPE that they can wear to collect specimens, and that we try and make it available to people who don't have a doctor. And so that's our focus at this time. It would be great to get to the point where we can test people who don't have symptoms. But I think we're going to have to rely on development of tests on the national stage for that. And we're paying attention to CDC guidance and state guidance on indications for testing. And as we learn more about indications for asymptomatic individuals, we'll share that with you.
So at this point, we still are working on a window of 2 weeks ago. Is that correct?
So the incubation period for somebody who's exposed to getting symptoms can be as long as 2 weeks. On average, it's more like 5 or 6 days. And so if that's what you're referring to, people who were exposed, up to a few days ago, up to 2 weeks ago, could be presenting with symptoms today. Yes.
Okay, just one more question. In some countries, South Korea, for example, they brought the new infection rate really low and a dramatic speed. Is it a matter of testing technology, or is it also the HIPAA laws in this country that are a hindrance to bringing those numbers into line?
I'm not sure how HIPAA would impact our ability to actually test people who need testing. And it's really a matter of getting our testing technology where it needs to be in this country. And so it's coming along. And right now we are doing our darndest to make sure that we have testing available to anybody who has symptoms. I think that should be our priority. We really need to take care of people who are sick, and moving towards where we can actually test people who don't have symptoms or identify community level immunity is much more involved. The use of those tests are, utility is still up for debate. And so I do not know where the HIPAA laws come in. We take care of people who need taken care of, and are very careful with any information they share in order to identify contacts. And
I know those laws are very restrictive, and there's I'm sorry. I know those laws are very restrictive, and there's good reasons for those. I meant in a practical sense, more in terms of contact tracing.
Yeah, for contact tracing, what we routinely do is we talk to the individual who's sick, and they provide information on who they've been in contact with, so that we can make sure that we get those people informed, so that they're aware of it, that they were potentially exposed. And so that's part of our routine in public health practice, and we have the ability to do that under federal and state law to control communicable disease. And so that is not an issue for us.
Thank you.
Any other questions? Okay, I will once again thank all of our spokespeople for being here with us today. and our media folks for helping us spread the word about what's going on here locally. And we will look forward to seeing all of you on Wednesday at 11 a.m. Everyone have a great day.
Thank